Good evening and welcome to the Business of Aesthetics Expert Panel webinar. This empowering discussion is designed to help you navigate challenges, leverage opportunities, and build a thriving career in aesthetics. Thank you for joining us, and a huge thanks to our panel of renowned industry leaders for being here. Tonight, we'll be sharing actionable strategies, best practices, and valuable insights to tackle the unique challenges aesthetic professionals face today. Let's also give a warm welcome to our panelists, Keita Hanlon, Ashley Rees, Elena Forsberg, and Shonda Durantes. It's truly great to have all of you with us tonight. Thank you for taking the time to share your wisdom and experience.
Thank you.
Thanks for having us. Yeah.
So, today, with our Business of Aesthetics expert panel, we'll be discussing a unique topic, and that is leading without an MD, how registered nurses and practice managers can drive growth. So, whether you're a registered nurse, a practice manager, or a non-physician leader looking to step confidently into leadership, tonight's discussion will give you practical strategies to elevate your influence, strengthen your team culture, and drive meaningful growth. From leveraging clinical expertise and operational excellence to build collaborative teams and scaling with strategic initiatives, you'll walk away with insights to lead with clarity and impact in today's evolving aesthetic landscape. So, this is a live event, so please engage with your peers, ask questions, and share your reactions. We are confident you'll leave tonight equipped with actionable strategies you can implement immediately. So, but before we dive into tonight's conversation, there's a quick tip from the Business of Aesthetics. When potential patients search online for treatments you offer, does your practice actually show up, or are they finding your competitors instead? Now, this is a major challenge for many aesthetic practice owners. You might be offering amazing services, outstanding services, but if you're not visible online, you're missing out on a steady stream of new patients. So, the good news is there's a solution, there's always a solution. With the right digital marketing, including local SEO, targeted ads, and funnel based content marketing, you can not only attract more inquiries but convert them to patients walking through your doors. Stick around until the end of tonight's webinar because we have something special for you to overcome this challenge and take your practice online presence to the next level. So let's get started to introducing our first panelist, and that is Keita Hanlon. Our first speaker this evening is Keita Hanlon. Keita brings over 25 years of clinical and educational experience with deep expertise in vascular and aesthetic medicine. She has trained healthcare professionals across the country and currently serves as a senior clinical advisor at MediFarms, Acera, and Sclerosafe as a medical spa owner since 2002. She blends practical hands-on insights with clinical depth, making her visibility respected voice in the field. Keita, it's an absolute pleasure to have you with us. Welcome to the panel.
Thank you. Thank you so much for having me. I really appreciate it.
And our next speaker is Ashley Rees, an accomplished aesthetic nurse, practitioner, and national trainer. Ashley has built a strong reputation in medical aesthetics, specializing in advanced injectable treatments that deliver natural, confidence boosting results. Beyond her clinical expertise, she's also dedicated to mentoring providers nationwide, sharing the latest techniques and innovations in aesthetic medicine. Ashley, it's a pleasure to have you with us tonight. Welcome to the panel.
Thank you so much for having me.
And our next panelist is Elena Frostberg, a board certified nurse practitioner and associate director of clinical operations at SD Botox. Elena is known for her leadership in driving practice growth, improving provider satisfaction, and ensuring a patient first approach. She's widely respected for her values of transparency, ownership, and approachability, which have made her a trusted leader in the aesthetics community. Elena, it's a pleasure to have you with us. Welcome to the panel.
Good to be here.
And our final panelist this evening is Shonda Durantes, a board-certified family nurse practitioner and the founder of Beauty Lounge Medical Spa, a multi-award winning aesthetic practice with locations across San Diego, and Temecula. Recognized nationally as one of the top 100 aesthetic injectors in America, Shonda blends her clinical expertise with entrepreneurship, delivering personalized evidence-based care that empowers clients to feel confident inside and out. Shonda, it's a real pleasure to have you with us tonight. Welcome to the panel.
Thank you so much.
So we have a great lineup tonight, and I am truly appreciative of each of you taking your time to be here. On your screen, you'll see the main points for today's discussion. I'm confident they'll leave you deliver and help deliver an insightful and amazing webinar. So in today's expert panel discussion, we will explore leveraging clinical expertise for strategic leadership, operational excellence, building a collaborative team culture, and driving business growth through strategic initiatives. We also have some excited questions prepared, and I am excited to dig into them with you. And of course, when it comes to questions, you can spend around 45 minutes in each question. There is no limitations. Again, go what feels right. And for the audience, if you do have any questions that you want to ask from the panelists, please go ahead and share it in the chat or in the Q&A, and I will bring it to the discussion. So with that said, I will start with the first question for Keita. So Keita, you mentored and trained professionals across the country. How have you seen the role of non-physician leaders evolve over the years in terms of influence and strategic decision making?
Well, when I first started in the med spa space, well, really, med spa space really didn't exist back in 2002. I mean, Botox had just received FDA approval, and it was just starting to launch in the United States. And so really the only thing that existed back then was, microdermabrasion, collagen. That's kind of it. And so when we first started injecting Botox, there weren't that many people doing it. I'm in the Dallas area, and there were not that many of us doing it. And it was extremely profitable back then. A vial of Botox, I mean, was a little over $300 a vial for 100 units. And I mean, it was a lot of fun. We made a lot of great money back then. And then, then more and more, practitioners started picking up, more of the aesthetic procedures, with the neuromodulators. Hyaluronics, came to market, and that was huge. And it became a very interesting lay of the land. I mean, I feel like, I had a pretty good run for about 15 years. And then the competition just continued to grow and grow. And you had a lot more physicians, whether it be family practice, some of the surgeons that were really tired of reimbursement in their practices, and they were looking for supplemental income. And that supplemental income was by opening up med spas. And so laser started to come into play. So at that, I would say probably around 2000, 2005, I was training a lot of physicians across the country in just how to open up a med spa, training their staff from front to back, how to even communicate with these patients. I mean, I had patients that came in for Botox that were scared to death that they would, something bad was going to happen to them, because not many people were even aware of how amazing Botox would be until they started getting it. So it's fascinating when I think about 2002 to where we are now, and all of the aesthetic meetings that are out there, all of the injectors that are out there. And I mean, we have a panel of ladies. The women have just taken over the aesthetic market, and the nurses have. Yes, I've trained the physicians, but most of the time the physicians say, okay, that's great. Now, can I just have you train my nurse practitioner or my PA in the office? Because I'm going to go do surgeries, and I'm going to go do other things that, that generate more revenue for me. So, now when I'm at the aesthetic meetings, it's a lot of fun. It's a lot of women, and we have a great time, and it's so much fun to share with one another, what we're doing out there. And I really appreciate, the collaboration and the peers, and just the evolution of aesthetic medicine, really.
Amazing. Thank you, Keita. And I think it's a great way to start this discussion, and also it's an important perspective on how this industry has expanded and matured over time. So, over to you, Ashley. So, Ashley, as a nurse practitioner and national trainer, how have you used your clinical background to establish authority and trust with both your patients and your team, especially in a leadership role without an MD title?
So for me, it has been leading through education, consistency, and my results. I feel like those have meant more to my patients and my staff and team than any title ever would. Um, Education is one of the biggest things because I tell patients, just kind of like Keitha was saying, like, I've been training and all I do is study like Botox fillers, anatomy. And whereas like the doctor above us, our medical directors, they don't know it like we do. They're doing their continuing education in surgery or this or not that, not in aesthetic medicine. So, really, I think what shines is the education and it helps support our whole team. And the patients just trust it because they're like, yes, she knows what she's talking about. I can go to her, like, and it doesn't matter about the doctor title. Like, yeah, sure, here's your surgeon, but they're not doing your lip filler all day long. They're doing your surgeries all day long. So definitely leading through education.
Appreciate that, Ashley. I think you highlighted how credibility is built not just through the title, but through skill and consistency.
Absolutely.
So, So, Elena, as the Associate Director of Clinical Operations, how do you balance clinical expertise and operational leadership to influence your team's culture and performance?
I mean, balancing the clinical expertise and operational leadership, it's always a delicate game, right?
Mm.
Because at the end of the day, we're a business, and that can't be avoided. But that can occasionally be at odds with clinical practice. But I think the two can actually be quite complementary. We measure a lot of KPIs at my practice. We've got 7 locations, so we have a lot of providers. And two of the monthly KPIs that we measure is the average units per patient, and retention for both first time and existing patients. And I mean, what we found over the last 2 years is that as the units went up, so did patient retention. And obviously, more units means more revenue for the practice, but it also means more money for our providers, both because of the increased units and the increased retention. Because I mean, nobody's working for free, and nobody wants to have an empty schedule. So, by increasing provider education around like dose and duration, and also to not be scared of being a little bit more heavy-handed when dosing. And then as a practice, being transparent with that data with our providers, it's a way to kind of make everybody happy, and balance both of those two sides of the coin.
All right, all right. Thank you, Elena. That's a great example of how I think leadership combines both patient-centered care and operational excellence. So, um, Shonda, as a nurse practitioner leading a multi-award winning medical spa, how do you recommend registered nurses and practice managers establish authority and credibility in settings where patients or even colleagues might expect an MD at the helm?
Well, credibility in the med spa setting often starts with transparency and education. I always encourage our nurses and practice managers to explain their role as far as training and scope of practice so patients understand the depth of the expertise we all bring to the table. At the same time, authority is earned through the trust we build with our patients by being approachable and knowledgeable and deeply invested in patient safety and outcomes. So when we combine clinical competence and clear communication and compassion, patients stop focusing on titles and start valuing the quality of care that they are receiving. So I think it's how these non-traditional leadership models like NP and RNs and practice managers can thrive and gain recognition, not being an MD.
Excellent point, Shonda. So, all right. So, to the audience, if you're listening in, if you do have any questions, please feel free to add it into the chat or in the Q&A, and I will bring it to the discussion. We love seeing your reaction, whether it's a heart reaction or a thumbs up. it we love seeing your participation in this panel. So, with that said, coming back to Keita, as someone who has run a med spa for more than 2 decades, what lessons have you learned about building sustainable systems that keep both patient care and profitability strong over the long term?
Great question. And every time I have gone across the country to train somebody and I walk into this huge, beautiful facility and the physician is stressed out, the medical director, whoever it is, they're just like, oh my gosh, I've got this, this lease payment. I've got all this equipment now. And what do I do? Like they're just standing there. And a lot of times walking away from those places, they think by just putting the sign out, making the pretty place, that they're all just going to flock in. All the patients are just going to come in, and that's just not the case. And so if I ever speak to somebody that wants to get into this industry, I always tell them, start small. One room is fine. Just and start with not everything. You don't need to do everything at the beginning. Start with maybe a handful of procedures and perfect those procedures and be great at what you do. Because I know when I first started, and we started with what was just out there, which was very little. And then as we got bigger and we started adding more and more and more, and every trend that would happen, we would bring it on. And our menu was the longest list of things that we did. It even got so long where I would go, oh, I forgot we even offered that. So, it was stay focused on what you're really great at. If you're a great injector, stay focused on injecting. I leave all of the laser work now to somebody else. You do that, because I love doing filler, I love doing neuromodulator, I love sclerotherapy, and I love threads. And that's all I stick to. Those are my favorite things. So, start small and build from that. If you don't have the business to support, a multi-million-dollar facility, and you're just grabbing, somebody off the street that wants to learn really quick how to do these procedures, and you don't get great outcomes, you're not going to be successful. I mean, all of us here on the panel have been doing this for a long time. I'm sure that we have all dissolved filler. We have seen, the mishaps, and it breaks my heart for patients because there is a lack of education out there for the masses. And it's so important. It's our responsibility to make sure that we are educating our patients. And that's how you'll have the longevity as well, is that education and the expectations, and really providing that high level, customer service. And you just can't do it if you don't know what you're doing to start off with, so start small. That's and work from there until you're busting out of your place. Stay in it, start with one room, and then grow from there, and bring on the right staff that have the same mission statement that you do. You're aligned, you're on the same page. You love patients the way that, they love the patients the way that you love them.
Exactly. So start small. So just as Keita said, thank you, Keita, for that. And I think those are some actionable strategies anyone starting off to look into this career, or starting off to basically, or feeling burnt out actually, on how to look at this lens, on how to be successful in this industry. So Ashley, what systems or processes have you found most impactful in streamlining practice operations, whether it's scheduling, patient flow, or treatment protocols that registered nurses and practice managers can take ownership of?
So I think having clear systems make all the difference. Standardized treatment protocols keep care consistent. And I think allowing your staff, your providers, your front desk to have impact, or to have the ability to say what works and does not, is very impactful, and it will have them take ownership of it as well. So like in our practice, we are just very honest and open with each other, like what works, what doesn't work, kind of like a stay in your lane. Like, how can we make this very clear that, the front desk is going to check everyone out for all the providers and the estheticians will check out in their rooms, and then just kind of empowering the staff to follow these and just have clear communication really helps to make the whole practice run smoother.
All right, all right. Thanks. That's I think that's it's all practical systems, right, Ashley, that you just meant.
Mm-hmm.
All right, all right. Perfect, perfect. So, okay. So Elena, from a leadership perspective, how can non-physician leaders contribute to both provider retention and business growth, ensuring that the practice thrives long term?
Um, I mean, at the end of the day, RNs and practice managers, we drive this field. I mean, just like Ida was saying, it's majority RNs, majority women that are in aesthetics. So being a leader while also being in the trenches and dealing with the day-to-day things that are going on, good and bad, it means that we're in a wonderful position to really demonstrate our values and model the transparent, the honest, collaborative culture that contributes to provider success and retention. I think our unique experience in the day-to-day of the practice, it means that our voice holds a little bit more weight during business discussions, which ensures that any initiative or process change or implementation is actually practical, and that is actually going to work, because that's ultimately how we can help drive practice growth and success.
Thank you, Elena. I think that was a very excellent insight into the link between leadership, retention, and growth. So, so back to Shonda. So, um, many non-owners want to contribute meaningfully to growth. From your journey, what's specific initiatives, around services expansion, patient loyalty, or community engagement, have you seen non-physician leaders drive successfully?
So I found that non-physician leaders often drive growth by bridging service innovation with patient loyalty. Nurses and practice managers are usually the first to recognize emerging patient needs. They hear what the patients are saying, what's working, what's not. And then they can help reshape or restructure current processes or protocols, really letting them take ownership in the process that we all contributed to it. At the same time, they're the ones building the lasting relationships through the follow-ups, the personal touches, maybe remembering the birthdays, sending out the thank you cards, anticipating patient needs. So it's like that combination of insight and connection that not only helps expand services in a meaningful way, but turns first-time patients into loyal patients and long-term patients.
Exactly, having the long-term patience. Amazing, Shonda. So, before we jump into the next set of questions, I want to take a pause for a moment and share something valuable with you, and that is why everything about this panel is all about, is making sure we share valuable strategies and all actionable takeaways that you can implement right away. So, um, So we've been talking tonight about leadership without an MD and the strategies registered nurses and practice managers can use to drive real growth. But here's the reality. Even if you are leading brilliantly inside your practice, your impact can only go far if new patients aren't finding you. So that's why we prepared something special for you. The solution I was talking about earlier, it's directly tied to the conversation we're having tonight. So you're invited, anyone here who joined this panel tonight, we are offering you a complimentary practice growth strategy session consultation from the business of aesthetics. So our team have worked with hundreds of practices just like yours, and here's how it works. You'll meet with one of our marketing advisors before your call. We'll actually study your online presence, your local competition, and your search visibility. And when you connect with us on the meeting, we'll actually show you through a personalized recommendations, walk you through a roadmap on how you can actually achieve that numbers when it comes to online visibility. So you will learn things that you will not know about your online visibility, which a lot of practice owners, when they come to the meeting, they talk with us. So you'll see a QR code on your screen. You can use this link in the chat to reserve your session. Again, this is all completely free, complimentary, and again, there's no strings attached. Think about this way. Uh, what's the risk if you say yes? Just your time, no strings attached. But what's the risk if you don't? You could miss a real opportunity to grow your practice, visibility, attract more patients, and support your leadership with the growth of your practice. Your practice deserves. So it's free, it's custom, and it's designed to help you take the next step in building a thriving med spa or practice. So I'm going to leave with you with that. And I highly encourage you to take that opportunity because it's all about action. This panel matters if you take action. So with that said, I'm going to jump back into the questions with to Keita again. So Keita, from your experience, both as a trainer and an owner, how can non-physician leaders mentor and develop future leaders within their teams to create a culture of growth?
Well, I think Ashley had brought this up about making sure, I'm sorry, and if it was Lina, just making sure that your staff has the ability to go to conferences. You have the ability to bring in, some clinical trainers into your own office to make sure that your staff is fully trained. For me, in an office, it's so difficult to get away because, obviously when you're in your own office and you leave, you're losing money. So it can be challenging. So, making sure to carve out that time throughout the year to at least get to one conference that is wholesome, that, AmSpa has been great because they provide so many different hands-on workshops, which are phenomenal. There are a lot of vendors that participate. So that's a great way to make sure that your staff is educated, and just put that money into your staff. You'll see the return on it.
Amazing, amazing. Since I mean those are great points, Keith. I think leadership is about passing the torch and developing the next generation. And I think you captured that well. I think going into those going into those conferences and understanding, and I think as you mentioned, some conferences that are really well leading in the industry would be great for anyone listening in. So with that said, to Ashley, from your experience training providers nationwide, what strategies have you seen work best for fostering collaboration and cross-functional communication within a practice team?
Honestly, I think having your staff kind of cross-trained really helps communication. I know when we have a new front desk person, we will have them shadow an injector for a day so they can kind of see what the process is like, consulting a patient, drawing up the meds, and then walking them to the front desk to check out and reschedule. That way, that front desk person is on the phone next, and a patient asks a question, they're able to kind of say from experience, oh, well, when you're with your injector, she will give you a consultation and tell you this in person. So she kind of is speaking from somewhere. And then the same, I think, with the esthetician, shadowing them, and then both your esthetician and your injector or provider being at that front desk and kind of knowing how that workflow goes. I think that helps collaboration because we all kind of understand now what we're all doing, and it makes communication easier. So you're not just like, oh my gosh, this person doesn't listen or they're not doing this part. And they're like, okay, we kind of all understand each other's roles and we can communicate now on the same page because we understand it.
Thank you, Ashley. I think human collaboration is really the heartbeat of a strong team. So without collaboration, there is no teamwork. Um, so Elena, you emphasize approachability, transparency, and ownership. How do you apply these values to build trust and collaboration across diverse teams following the previous question?
Yeah. So some would argue that I'm probably too transparent at times. But being transparent is really important to me. Like I mentioned KPIs earlier, if we're measuring something or we're changing a process, I want our providers and our staff to know the why behind it, versus it coming from the top and being like, we're doing it this way, this is how it's going to be. It's usually not received well. But once they understand where the change is coming from and that the change is not solely to line the owner's pockets, it's for the greater good, they're much more likely to buy into that change. And by remaining a practicing provider who still sees patients, I've still got, like I said, that on the ground perspective, which helps build trust as well. I never want anybody in the practice, whether it's front desk or whether it's providers or some of our administrative team, I never want them to feel like they can't ask a question, or that like if they ask a question that they'll be talked about or ridiculed among their peers, their coworkers, if they ask a question. And I do my best to be approachable and be that person that anybody can ask questions to. I might not know the answer. I'll point you in the right direction, but I just want to be as open and honest as I can. And I mean, I ask questions all the time. I think we all do, as providers, and that helps foster that collaboration, helps foster that open and honest culture. And regarding ownership, I strongly believe that taking ownership of I believe in taking ownership of your success, and ownership of your mistakes. And, and in the practice, like if a provider wants to lead a training on lip filler or somebody has suggestions for a process improvement, I really empower them to take ownership of that initiative, which both facilitates collaboration because then they're collaborating with, their colleagues, with our marketing team, with, finance to try and make it work. And then when that initiative is implemented, it increases their trust, not only in me, but in the practice, that we do want them to grow. We do want, to foster that collaborative environment, and that everybody's ideas, can be heard. And so that's why, I mean, approachability, transparency, ownership. I mean, those are kind of the three things that I base my practice out of.
Thank you, Elaine. I think that's an excellent response. And since this panel is about leadership and taking up to the next level, and it's most of these questions are very much alike, and I would like to get the perspective from Shonda and Keita on the same approach about approachability and transparency. Shonda, what do you think about that? I think you're muted.
I'm sorry, can you repeat, because it was kind of glitchy, like
All right, sorry. So what I mentioned was since this panel is all about leadership, and I mean, emphasizing on approachability and transparency and ownership is one of the core aspects of what we do in this industry, right? So I would like to get your perspective on that. Like, how do you apply these values to building a trust and to build that trust and collaboration across diverse teams?
So, I mean, really, I think your team has to have trust in you. I'm going to piggyback on like that. We're not just trying to line the pockets, and that it's not greed driven, that they see that we have our patients' best outcomes at heart of what we do, that we are doing, getting all the right technologies in the office as far as like having ultrasound, Accuvane, so we can be safe, competent providers, and that we're instilling that and the new staff that are coming on board, that this isn't a drive-through, that we care about patient outcomes. So I think that builds credibility and trust amongst the team, so that they'll then credential the different providers, when they're on the phone, and say, oh, Shonda's amazing. She's been doing this a long time. She does my lips, are, amazing. And so in the office, she's great at doing the erbium. Her patients have the best skin. So I think that's so important that we all model that for each other. And I think it kind of rubs off on one another. Oh, you're going to another conference? I want to come too. Or what's the link for that webinar? So I think that goes a long way, and kind of creating that culture of continuing education and competency and trust amongst each other, and really being able to credential each other.
Excellent, amazing. Thank you, Shonda. Keita, what do you think about this approach?
Yeah, I absolutely agree. I think transparency is really important. I mean, the girls that I have, I've had them with me for over a decade, because I treat them like they're my family, and I am not beneath answering a phone and scheduling somebody. So I think that it's really important to, not only the collaboration part, but everybody have a vested interest in the business, whether it's, somebody in the office that loves to post, and that is not my wheelhouse at all. Um, and everybody that knows me knows that I am never on social media. I'm just too busy for it. But there are people that are amazing at it, and you have to tag you're it, and you're amazing at this, and this is what you should do for us. Like, we're a team. So, assigning people in the office that where they feel like they have, they're an owner too. Make them feel important, your staff, because I'm there's a lot of turnover out there. I get messages all the time from physicians saying, "Hey, do you know of a nurse injector, or do you know somebody, an esthetician that I could hire, in my med spa?" I get those often, and it makes me sad for the practitioner, because if I go in there, I could probably figure out where the miss is. But let's try to treat everybody equally, in the office. I'm sure Elena could speak to that really well, because she has 7 med spa locations. I know she's probably created some sort of culture among all 7 of those, and trying to keep it very consistent. And that's hard, to open up one and then open up another and open up another and provide that consistency is impressive, because it's not an easy task to do.
For the
I
record,
think
Keita, thank you so much for thinking I own all 7 med spas. I do not. I work for a larger practice, so
Okay,
the owner
okay,
has
yes.
the owner has done a great job
Yes.
of all of that, but I don't
Okay.
want to take credit.
Yeah. So 7 different locations. I mean, that's a great feat, so.
But I think I do have the next question for Elena regarding culture, since you brought that up, Keita. So,
Sorry.
It's all right. It's okay.
You got this.
but before that, Ashley, would you like to add anything with regards to this approach about approachability, transparency, and ownership?
I think you have to just kind of lay it out there. You have to be transparent, not only with like patients, but your staff. You have to. Absolutely. I think it helps build trust, accountability, and it just makes the team play well together, and it gives a great culture. And that's important.
Amazing discussion, amazing. I think it's basically, in other words, setting each other up for success. So with that said, so Elena, what just Keita mentioned, how do you keep the culture consistent within all these locations? Isn't that a big challenge for you?
It is a challenge, especially because with our 7 locations, there are different areas of San Diego. We have locations that are, probably an hour and a half away from each other. And so it's not very often that we can all get together as a staff. But what we've done, at least on the provider side, is we have quarterly provider meetings. And so every quarter we all get together, either at one of our offices or an offsite location, and go over any changes, make sure that everybody's kind of up to speed on all the different, ways we're doing things, any changes that are upcoming. And then we are big believers in GChat. So we have plenty of Google chats that keep communication open. And every office, runs a little bit differently, just based on personalities, based on what works for them. And so small little tweaks in how things flow are made. But in general, we try really hard to standardize it, because that way, when a patient comes to one of the SD Botox locations, they're getting the same great treatment, they're getting the same great service, no matter which location they go to.
Amazing. I think that's basically what everyone is looking for, just everything consistent in all locations. So yeah, back to Shonda. So Shonda, in your experience, what are the most effective ways for non-physician leaders to foster collaboration between clinical and administrative teams so that patient care and business goals stay aligned?
So I think it's going back to piggyback on everybody about transparency and open lines of communication, having regular, just staff meetings with updates, sending out memos. We do teams here, so a lot of teams give a team announcements, and then this one's for this and this one's for that, so the messages don't get lost and you can easily reference it. Lots of job aids, looms, just to keep everybody in the loop, because there's some people that are only here 2 days a week. There's some people here that are 5 days a week. I have some providers, kind of like Alana, that only work in certain offices, and some only in this office, some in all three. And so it's really easy for things to get dropped, lost between the cracks, and that we want, again, consistency between the results that we're getting from, the way this esthetician gives a hydrofacial to this one, oh, well, she gave a 5-minute massage. Why does she give a 15-minute one? That way, the patients know what to expect and that there's no like lapses in care and results. So communication is huge. And I love empowering our staff to take the lead, and maybe this team member is going to give a whole presentation on microneedling RF versus micro this, or maybe we're just going to go over all the different exosomes, serums, topicals we can use. That empowers them to really be an expert at that one. And then it gives more advanced training to our front of the house team that typically is not getting the advanced training that the providers get. And I feel like it's really different when you're teaching it, you really learn it and master it versus when you're the student sitting there. So I think that's all important, letting everybody have a piece of the ownership, that they're responsible for this initiative or that initiative. And I encourage them, when they take on these responsibilities, add it to your resume. This is very impressive to add later. Like when we launched our medical weight loss program, the 2 team members that helped launched it, I showed them how to put it on their resume, that they should be very proud of that. It's a very big career, I guess, milestone, you could say.
Amazing, amazing. Thank you, Sean. I think it's a powerful reminder why that alignment between, clinical and business goals is very important. And yeah, so to stay surviving in this industry. So with that said, to Keita. So Keita, the question is, having owned and grown your medical spa, what strategic initiatives have proven most effective for long-term business resilience, especially during times of industry change?
Oh gosh. I would say, at this point, if I look back, we have such a close relationship with a lot of these women that, some of these women have been coming for over a decade, and really personalizing their visits. I don't like to rush people when they come and see me. I will block out a full hour, sometimes even if it's for Botox, because I want to catch up with the person. It's okay. To me, it's about the quality at this point in my career, the quality of that visit over the quantity of people that I have in, because these relationships are so valuable and I cherish them, and I'm super grateful and I'm blessed that, that they, in a very competitive environment where there's a med spa almost on every corner, that these people continue to come see me. It's a blessing. But we take the time with people. Everybody in the office, it feels like you have a cousin coming in, or a distant relative coming in every time somebody walks through the door, and that's how we treat them. We don't make them ever feel like they're rushed.
Amazing, amazing. And since these are questions, of course, asked by the attendees, and I want to make sure, like, as these are also the final questions, I want to ask from Keita on that same note, what's the final advice you would like to take, if anyone listening in, anything that you want to take away from this discussion? Keita?
Yes. Oh, I'm sorry.
Yeah.
I thought you were. Oh, I thought you were asking somebody. Okay, so
No,
what do I want to take away from this?
no, yeah. Anyone listening in from this discussion, what is the final advice or one
Oh,
advice? Yeah.
okay. For me, it's just love people well, and be honest in your business. don't cut corners. Just
Mm.
do the right thing always.
Amazing, amazing. Thank you, Keita. So now, Ashley, in your role at VO MedSpa, how have you contributed to business growth, whether through patient loyalty initiatives, expanding services, or education? And to that same question, again, I'm asking, what advice would you give from this discussion?
Okay, so while I was at VO Med Spa, I really focused on patient loyalty and just my ongoing education to really drive my growth and help like contribute to the business. Um, I think education is kind of the foundation of it all. People will come to you, they will be loyal to you if you know what you're doing, you're consistent, your results are showing. So definitely that is how you can contribute to the business growth. And then overall, I think a big takeaway, like Keitha said, I feel like it is just being true to you, being honest to that patient, and just doing good for your patients, doing good business.
Exactly. Amazing. Thank you, Ashley. To Elena, so what operational changes or systems have you implemented at ST Botox that have the biggest impact on both provider satisfaction and patient outcomes? And to that same question, what is one key takeaway that anyone listening in could take from the discussion?
Um, I love this question. The biggest impact on provider satisfaction and patient outcomes, like we've been harping on, like Ashley, Akita, Shonda have all said, definitely education. We, a couple years ago, developed a training department. And prior to my role now, I was the training and education lead and worked really closely with our training coordinator to procure models. That's always a very difficult thing with training, is finding good quality models, both personality and physical candidate. And so she would do that and help facilitate the operational aspects, scheduling, blocking out calendars, that sort of stuff. As a practice, one of our core values is expertise, and we really, really take that to heart. Every potential injector we interview, they cite the amount of education that they hear that we provide as one of the main reasons that they want to work at SD Botox. And as existing providers stay. I mean, our retention for providers is really high in the industry. And one of the big things is they appreciate all the education that we allow them to do and that we offer. I mean, just last year among 13 providers, we did 389 hours of paid training, which averages out to about 30 hours per person. And that doesn't count like the dinners, the roundtables, the conferences, all of those offsite opportunities that they also get to be a part of. And so just the amount of education that our providers receive, it's evident in patient satisfaction and evident in their outcomes. So that's part one of that question. Part two, what I want people to take away from this, like the other, like Ashley and Keita were saying, be good. Treat your coworkers well, treat your colleagues well, treat your patients well. But I also think in terms of growth, knowing your numbers, I mean, that's huge. Knowing your averages, knowing your revenue per hour, knowing your retention rates, knowing your average Botox units per patient, just having that baseline, not only for yourself as an injector, I know I find it very useful, but also just for your staff to know where they stand, especially at a larger practice. Not everybody sees everybody else's numbers, but seeing where they're at compared to where our goals for them are, where average is for their colleagues at the same practice. I think that was a huge turning point when that was implemented. So just having the data, that's how you can see where your starting point is, and then look back 12 months from now and see how you've grown.
Amazing advice. I think just you highlighted data is your friend. So if you have the data, you can learn a lot of things that you might not know. Um, so with that said, to Shonda, in your experience, what are the most effective ways for non-physician leaders to foster collaborations between, sorry, not that question, but uh, so you scaled Beauty Launch Medical Spa across multiple locations. Now, what practical steps can non-physician leaders take to own systems like scheduling, patient flow, and treatment protocols to improve both efficiency and patient outcomes? And to that same question, what practical takeaway can anyone listening in take from this discussion?
The scaling of practice requires strong systems, and non-physician leaders are often the ones who make them work day to day. We're the ones implementing them, seeing what's failing, seeing what's working, and making those little tweaks along the way. Practical steps include like standardizing schedule templates so appointment times match the actual flow of the practice. Did we book too much time, not enough time? Are providers always running over, and then people are waiting in the lobby, and then they're unhappy because they're behind? So making sure that we, catch those things and tweak accordingly, creating clear patient intakes and checkout processes, developing treatment protocols, that every provider can follow consistently across all of our offices. That way it's standardized. At Beauty Lounge, our practice manager and nurses have owned these systems, tracking waiting times, identifying the bottlenecks, refining workflows based on patient feedback and feedback from the other team members on staff. This team ownership has allowed us to successfully launch new programs such as our GLP-1 weight loss program in 2020, hormone replacement therapy last year, and we just launched peptide therapy. We soft launched it last month. So we're really excited to drive those new areas of our business. When non-physician leaders take the initiative in designing and maintaining these systems, we see more efficiency, more collaboration, that ownership, that pride in our work. So the whole team is empowered to deliver a higher level of care. As far as takeaways, I feel like the biggest takeaways I've heard from all of our insights: communication, transparency, remembering our reason why, as far as like we are here to give the best care possible, have the best patient outcomes. And I think as leaders and owners, it's important to delegate some of these responsibilities. In the beginning, you're probably terrified to, give away duties and such, but really taking that practice manager, maybe that nurse that's a blossoming leader, and giving them some of those responsibilities, teaching them how to run those reports, teaching them how to analyze them. And that's when the light bulbs start going off in their head. Oh, wow, we only did this many dollars per hour. We really need to be at this, and we would have hit our goal. That was just upselling an up week, or adding on Latisse to the sale. If every nurse could have done 2 that week, we would have hit it, or whatever. So I think empowering them with those different responsibilities really makes that whole picture connect, and then we're stronger together.
Thank you, Shonda. I think that's a great way to wrap this discussion, and how you just mentioned on empowering your teams to take them to the next level. And that's basically what this topic was all about as well. So with that said, I just realized what time it is, and well, tonight the time was flying. So it was a very amazing discussion, and I was very thrilled to hear all these strategies and things, and I learned something new as well. So with that said, let me get my screenshot. So I would love to keep going, but I want to be mindful of everyone's time. Tonight has been awesome. So many comprehensive answers, valuable takeaways, and rich insights. Thank you all so much. Before we officially close tonight, just a quick reminder: if you haven't already booked your complimentary practice growth strategy session consultation, now it's the time. Our team will personally review your online presence and competition before the call, so you get tailored insights for your practice. And again, the QR code is on the screen. You can grab that. There's a link in the chat. It's free, it's custom, and it's designed to help you take the next step in growing your practice with confidence. So with that said, actually, our time has come to an end. It has been awesome. First of all, thank you to our expert panelists, Keita Hanlon, Ashley Rees, Elena Frostberg, and Shonda Durantes. You all were amazing. You shared so much insight, amazing best practices, and wonderful actionable content. If I were to sum it up, I'd say collectively, you made the complex simple, the hidden visible, and the difficult easy. Secondly, thank you to all of our attendees for the privilege of your time. and participation. Without you, we don't grow together. Without you, we don't set each other up for success. So, a reminder to like, share, and review us on your favorite social media and stay connected with our panelists if you like a deeper conversation like this. Until next time, on behalf of our panelists, keep striving for excellence and exceptional patient care. Thank you again for being with us tonight. We'll see you at the next expert panel series. Until then, take care and good night.